Hi everyone, I am Dr. Anthony Dakpallah, but you can call me Tony. Today we'll be talking about one of the most exciting and sometimes nerve-wracking moments in pregnancy, your first ultrasound scan. If you've ever wondered, why am I having this scan? Or what exactly are they looking for? This video is for you. Let's break it down simply and clearly. So, when is a first trimester scan done and what is it for? The first trimester scan is usually done between 6 and 12 weeks of pregnancy. It's often the first real confirmation that you are pregnant beyond the test strip. Yes, the test strip will tell you you are pregnant, but we need to confirm the pregnancy with the first trimester scan, especially that we don't know exactly where the pregnancy is at that time. So, it's not just about seeing a baby picture. This can help us to answer some very important medical questions. We check to see if the pregnancy is inside the uterus to rule out an ectopic pregnancy. Sometimes a pregnancy may be found at other places other than within the uterus where it's supposed to be located. And if we have something like that, it becomes an ectopic pregnancy and has to be managed as an emergency. We also want to see if there is a heartbeat and we want to know how many babies are there. Yes, twins or even triplets. And if you're lucky, maybe quadruplets. And how far along are you? And we do this by measuring the tiny embryo or fetus. All this helps doctors and midwives plan your care accurately. So, what happens during the scan? Now, here is what actually happens when you walk in for your first pregnancy ultrasound. Depending on how early you come, the scan might be done transvaginally, meaning a small probe will be placed gently inside the vagina. This is because at 6 or 7 weeks, the pregnancy is still very small, and this gives us a much clearer view. Let's say it balloons out the pregnancy for us to see. So don't worry, it's safe. It doesn't harm the baby, and it's usually over in a few minutes. If you are further along, let's say around 10 to 12 weeks of gestation or pregnancy, the scan might be done over the tummy instead, using a bit of gel. Either way, the goal is to see the gestational sac, the yolk sac, the fetal pool, and if you are lucky, even the tiny flicker of a heartbeat. What are we looking for and why does it matter? During this scan, we also check that the uterus and ovaries look normal and that there are no unusual fluid collections or signs of complications. If everything looks fine, great. You'll get your first ultrasound image and a beautiful little dot or bean shaped embryo, usually around a centimeter or two long, would be within that image. If something doesn't look quite right, like if we don't see a heartbeat yet, we may ask you to come back in a week or two or for a follow up scan. And that's totally normal, especially if your dates might be off. It doesn't always mean something is wrong. So let's talk about the emotional side of things Now I know this can bring up a lot of emotions, excitement, fear, hope, and sometimes anxiety. And that is okay. Remember, the scan is not just about the baby's picture, it's about making sure that everything is developing safely for both the mother and the baby. So, if your sonographer or doctor takes their time, it's because they are carefully checking all the important details. What comes next after your scan? After your first trimester scan, your healthcare provider will one record the estimated due dates so that you know when you are likely to deliver. They would also review your results and then they will plan your next scan, which is usually going to be around 18 to 22 weeks for a more detailed look at the baby's organ and growth. That's what we'll talk about in part 2. That's the second trimester scan, which will be coming up in our next episode. So, that's what really happens during your first pregnancy scan. It's safe, it's essential, and it's the beginning of a very special journey. If you found this helpful, hit the like button, subscribe, and share this with an expecting mother who might be nervous about her first scan. And remember, every pregnancy is unique. So always follow the guidance of your healthcare provider. See you in the next episode when we take a closer look at your baby's growth in the second trimester. Have a good day.